Hey everyone, I'm Lamar with MedRank Interactive. This is the Healthcare Digital Marketing Podcast. Super excited to talk with Tim with REVA Global Medical. With Tim, right? Like you're in the business development side. You've done that for 10 years. You help practices improve their, performance and revenue. Also, what's interesting, I saw that you're a hockey player. So, going from like hockey to medical, I would love to, have you open up and kind of give us some background information on who you are and what you do.
Yeah, absolutely. So I appreciate it. Thanks for having me on, Lamar. I am Tim from REVA Global Medical. I started as a professional hockey player, played for about 5 years, but unfortunately, I was hurt. I herniated L3 to L5 and wasn't able to play
Wow.
anymore. So, of course, then I had to make the transition to the business world and figured what would be the best place that aligns what I want to do. And I have an older sister. I'm one of 13 kids. So I'm
Oh,
from South
wow.
Boston. Yeah. One of 13, me being number 11. So I'm one of the babies. So I had a lot of older brothers and sisters to be mentors for me, to show me the way and show me the ropes of what to do, both in hockey, my brother Brian playing in the NHL for 15 years, and then outside
Wow.
of hockey with my oldest sister being a doctor. I decided that the med world was probably the space that I wanted to go. Obviously, I didn't go to school to be a doctor or a nurse, so I had to get into the sales side, and business development is where I started, and then I got into being an account rep. And then after years of being an account rep, now I am on the business development, and I'm the director of sales and business development at REVA Global Medical. So I have a lot of mentors that have helped me along the way. The owner of our company, Bob, is also a former professional hockey player. So
Wow.
yeah, so that transition was pretty easy for me. He started this on the real estate side, this virtual staffing company, and from that he saw how successful it was, built it on the med side, built that out, sold it, and now we're doing it again. So that's where we are right now. And the reason for it, obviously, is just to help all these healthcare practices just save time, save money, and not have to work so much harder and have to wear 10 hats every single day, you know?
Yeah, that makes sense. And I'm excited to have this conversation because I don't even think we've talked to anyone that really supports medical practices in the way that you guys do.
Yeah.
But I guess side question, so is how do you compare hockey with medical? Because I'll give you my perspective from a basketball standpoint in marketing, but I'd love
Yeah.
to see how you compare the two.
Yeah, for sure. For me, it was just be like the traits that you have as a hockey player or a basketball player can build a great team for a med team, or like if you're in the med space. So obviously doctors and clinicians, they dedicate their lives to taking care of patients. So
Right.
they're in it to serve. Where on the sales side, we want to serve those doctors and we want to serve those practice owners who are trying to serve themselves. So what we look for and why I was able to transition, what in the commonalities I see, at least in a good practice or a good company, would definitely be being able to be coachable. Like every hockey player needs to be coachable. You need to be able to pivot, adjust whenever you have to if you're not doing the right thing. Definitely accountability would be the second thing. Just holding yourself accountable every single day to be able to do all and everything you can. And then the third thing would just be work ethic. And that stands
Yeah,
on that accountability as well, right? So the harder you work,
absolutely.
the more you're going to get done. But those
Yeah.
are just the common traits. But I would love to hear from you as well. What do you think?
Yeah, and I think with basketball, right? Like like it's tough to play basketball if you don't have skill.
Yeah, for
If
sure.
you're not giving the energy and effort and have the hustle and the grit. So I think how that, translates to marketing, right? Like you have to show up every day and figure it out and just work hard. That's like the first step. And then from there, like with marketing, right? You're ranking like how we look at marketing, right? Especially from a Google standpoint, we have to rank these websites in Google. And so we're
Yeah,
always competing with other websites and businesses. So from a basketball standpoint, you're always competing against other players, so
yeah,
and other teams. So that correlates. And then I think with basketball, right, like you have to learn to be a leader. You're gonna learn to be a team player. You got to be coachable. There's so many like skills that you have to really like gravitate to and learn and become really good at to be good at basketball.
yeah,
And you can somewhat like say, hey, if you can do this, if you can be a good basketball player and learn these traits, then it can be applied to marketing, right? Because then when you're on marketing teams, you have to learn to play well in the sandbox. You have to learn to strategize and be coachable because you may have a performance review and take that feedback and use that to be better. But and then it's, analytical, right? Marketing is
Yeah,
very analytical.
100%.
And
Yeah,
so basketball, if you're not studying the game, you're not developing your IQ, like you're gonna miss some things that could really improve your performance and results. Same with marketing, right? Like if you're not looking at the data, you're gonna miss some you're gonna miss some key like metrics that could really help improve, the rankings or the conversions, right? So that's kind of how I'll compare it. One more question on hockey for you. Were
can
you a
I just
fighter?
circle back to that point that you were just making there? Because
Yes.
that, yeah, just on top of that, actually in our office, we started with skill, right? So
Yeah.
skill is obviously very important. You got to have it in basketball, you got to have it in hockey, but there's a lot of ways you can get around it if you don't have as much skill as, let's say, Steph Curry or
Right.
Shane Goss to spare, who I played
Right,
with.
right.
So what if you don't have that? We have a sign that's hanging up on our wall. There's certain things that you can do if you don't have skill, and it's
Yeah.
just showing up on time, working hard, being accountable, being there for your teammates, all that stuff that you kind of elaborated on. But at the end of the day, at basketball, what's the score at the end of the day? What's the score in hockey at the end of the day? Who scored more
Yeah.
goals? Who had
Yeah.
more points? So
Yeah.
if you come into work every day and you check the boxes and you just be there to check, like get a paycheck, it's not going to work. But if you're there to really serve and work hard and try to get better, to put more goals on the board, that's
Yeah.
what's going to create that great team. So I just wanted to circle back to that point because I thought it was funny that you said that. We
Yeah.
have a sign that's hanging in our
Yep.
office that elaborates. Yeah, it's cool.
Nah, that's awesome. One last question for you. It's pretty a bit funnier question. So, did you fight a lot, and did your siblings prepare you for fighting in hockey?
Oh, mom was gonna be pissed, but yeah, I'm 11 of 13, and a funny story about just hockey away from med a little bit. My brother Brian is 8 years older than I am. So
Okay.
we had a brother in between us that we lost to SIDS. I never met him, but it was an
Oh
unfortunate
man.
situation. But my older brother Brian took it on him to be like, this is my dude. This is my little
Okay.
brother who I'm going to take along the ranks. But unfortunate for me, my older brother of 8 years older than me was 6'7", 255 pounds.
Oh
So I
wow.
mean, yeah, he was a big, tall centerman. He was a banger, and I
Whew.
obviously wanted to be just like him. And when we would play mini hockey growing up, when we play street hockey, I'd always be the instigator, would run up and try to hit him, and he'd shoo me off like I was a fly. But after that, it definitely made me be definitely a fighter a little bit more so just take care of my teammates. I wasn't going to be like, oh, hey, let's drop the gloves. But if someone hit
Right.
one of the guys wrong or there was a scruffle in front of the net, I'd be the one definitely to jump in because I've learned along the way. And
No, I love.
usually growing up was on the losing end of it. So it felt good once I was playing to be on the winning side.
Yeah, absolutely. That's hilarious. Yeah, I'm one of the younger ones in my family, with my siblings. Same, but it's for me, the younger ones are always the instigators because they're trying to
Yeah.
keep up with their older brother or sister, and they just want to, be included. And when they neglect you, it's like, okay, I'm
Yeah,
gonna lash out on you. So I love it. Thank you for sharing that, by the way.
absolutely.
But love to get into, what you guys do, right? And I think a lot of people don't talk about medical VAs, right? Because you have big budgets on staff and hiring. So we'd love to learn, like, when it comes to like those who are unfamiliar with medical VAs, like what roles can they safely and effectively support when it comes to working with
Absolutely.
medical practices?
Well, let's start with first of all, like who would be the people looking for this, right? Like who would be looking for a medical VA? And usually, if you're looking for a medical VA, it's people that want to take the task of a like front desk management tools or
Yeah.
back end. So we can sit anywhere along the workflow, but usually when people are looking for an AI tool to help with converse or just to help deal dialers and stuff like that, there's certain different things that a virtual assistant can do that AI can't do. But there's
Yeah.
certain things that a virtual assistant can do that aren't going to be face-to-face conversational, right? So for us, we thought of the idea like when you go into a hospital practice, it's important to have one person working at the front desk. So you have
Yeah.
that point of patient care. After that, those people make a lot of money, and especially for smaller practices, you can't pay someone. It's usually, at least in Massachusetts, it's 70 grand a year usually that those people at the front desk are making.
Yeah.
And you can't afford to pay 3, 4 of them if you're in a private practice. So
Right.
we are charging $12 an hour for a medically trained virtual assistant, and medically trained meaning they've been in the nursing or doctors, they've been going to school, or they're post grad for at least a year or two, medically trained on all of the fields. So they're able to chase down information, they're able to do that front desk management, they're able to talk to patients, then they're able to even do the back end billing, clear out any AR backlog. So We sit anywhere along the workflow, but we're able to help just basically change if a practice does everything clerical, they need to
Yep.
do everything. So it's clerical versus clinical. So if a
Right.
practice wants to do all the clinical work, focus on their patient, every minute that they're spending on that clerical is taking away from that patient care. So
Right.
anything that is admin work, anywhere along the line where you have to do admin work, RVA can sit there, make sure it's taken care of, and get you paid out at the end of the day. Where we see the most success in a medical VA is definitely at front desk management. Front desk management, just getting all those patients in, making sure you don't miss appointments, and then making sure all insurance information is eligible and correct at the point of entry, because then you
Yep.
know that you're going to get paid out and you're not going to have to chase down that information. So to answer your question, I know that was long-winded. I apologize, but to answer your question, it's we can sit anywhere along the workflow, and it's just to help that clerical work in a practice.
Man, that's awesome. Yeah, there's so many doctors that need that because we
Yeah,
talk to a lot of them, and they get overwhelmed with just all the admin work that their office manager takes care of a lot of it, but then there's still stuff falling through the cracks because of
yeah.
how busy they are. Um, when it comes to, I guess, like appointments, do they also, the VAs, can you also have them help with like missed calls?
Yes. So that's what, yeah. So on the front desk management, we will be sitting there like we're sitting right next to your front desk manager, but obviously we work out of the Philippines.
Okay.
So they'll be sitting there virtually. You'll call in and it will just be whatever call system you have set up to your practice. It will just relay that call right to RVA. RVA can handle everything from appointment scheduling. If you have a list of missed calls that they need to go chase down to rebook appointments, they do that. We can do everything from, like I said, call out to insurance companies saying, hey, why was this rejected? Get that. We record those calls, bring it back to the practice, and then resubmit the claim. So then you are paid out. And then
Yeah.
on the back end, yeah, and then on the back end or during the patient, we can do medical scribing for the doctors. If the doctor sits there, they don't have time or money to have someone take notes for them, and they don't want to have to take notes themselves. They want to focus just on the appointment. We can sit there too. So there's a lot of different ways that we can help. And there's a lot of it's just because in the Philippines, there's obviously money, American money is very good for them over there. So
Yep.
these people are very trained in what they do, and they can handle pretty much a whole doctor workflow or
Man,
practice.
I think that's huge because, like, even from a marketing standpoint, like a lot of doctors that we work with, they're getting new patients, but then there's a whole nother bucket of
Right.
patients that they could have, obtained, but they didn't answer the call because they were so busy practicing, right? And so I
Mhm.
think that's huge. So do you find that the VAs work well with the staff that's, in the
Oh yeah.
practice? Okay.
Yeah. So what we will do at the beginning is we take 3 to 4 weeks to train this VA on your EMR, your EHR, your systems, just to make sure when they hit the ground running, when you have to start paying them, they know exactly what they're doing and they
Okay.
know exactly how your practice operates and how your practice flows. So we take the long, extensive training period for that, and we can have them all, and we'll give them over to our client to just to make sure that everything's buttoned up there. Does that answer your question?
Yeah, that does. That's awesome. I mean, I think like a lot of doctors or even, medical professionals may ask, like, how do you keep this HIPAA compliant? How do you protect the
Yeah.
patient in terms
Mhm.
of, just keeping everything, safe? So like, how do you integrate the HIPAA compliance in that
Well,
aspect?
you definitely have to run HIPAA audits on all of our VA's computers, right? They work from an in-home setting, so they're in a room like I am, you or I am right now. They're not in a call center or anything like that. So each one of them is working off their own computer, their own line, and we will run HIPAA audits through those, and we will make sure
Okay.
everything is certified as well. So we make sure we check all the boxes just so everything's safe at the end of the day.
No, that's
Patient
awesome.
information is key. It's huge.
Yeah, absolutely, absolutely. Have you seen, like, obviously you've seen this, but can you like provide an example of like measurable outcomes for a practice by integrating, medical
Okay,
VA?
yeah. Yeah, so we had an IVF practice who was just wanted a person for wanted a VA for front desk management.
Okay.
And because of this, and this conversation is kind of going circular here, because of that front desk management, and they were able to catch those people that they calls they were missing. They were able to get those patients that they weren't able to schedule before.
Yep.
They saw so much success and so much more revenue coming in that they used that revenue to add another one for insurance discovery.
Mm,
So if a patient comes in, they give you insurance information, that insurance information is not correct, and you bill that out to the insurance company, you're not going to get paid out for the services that you render to that patient. So what our VA will do is they'll send a recorded call to that insurance company, and they'll just say what happened, why isn't this? They'll fix that in whatever insurance information is incorrect. So then they'll resubmit that claim and get you paid out. And these
mm,
things, so that was the second thing that IVF practice added. And then at the end, there's the AR backlog, right? So if you do, at the end of the day, if you miss out on appointments or pay or insurance gets rejected, that money is going to go into an AR backlog where at the end of the day, you're going to have to write it off. I'm sorry. So
okay.
before you have to write it off before timely filing, RVAs will go into that information, they'll scrub that list, and they'll try to clean as many of those insurance claims as possible. So then
Okay.
you can resubmit those and get paid out for those as well. So with one IVF practice with an IVF practice starting with one, they ended up adding three more. So they ended with four. And obviously you can see the success there just by the use case of that practice.
Man, that's awesome. Yeah, I have so many doctors like I talk to regularly that need exactly what you're talking
Yeah.
about just because they're overwhelmed.
And most of them don't even know because they're working so hard. And then when they do have to chase that information, they're like, all right, I just got to get this done. And then they're going to
Yep.
go back to patient care. They don't know how much money they're actually losing out or they're missing. So once they
Yeah.
add it and once they can see it, it's really the writing's on the wall there. It's pretty cool.
Yeah, I mean, yeah, it's just it's so like so many valuable points when it comes to just medical VAs and like I guess when did this start? Like when did you guys say, "Hey, we know this is a need, here's why." And how did you pick the medical space as the kind of the success aspect of this?
Well, so my our boss Bob, he was a hockey player like me, and when he retired, he got into the real estate space. So he spent a lot of time in real estate, and he was when he was selling houses and when he was doing all this real estate, he realized like the admin work was really tough. It was tough to keep up with the admin work and still try to compete, like we
Yeah.
talk about, with your competitors because they're out there in the field being able to get what. So we thought this he created this company for the real estate side, which was great, and he realized had a cut. He met someone. I'm sorry, he met someone at the time who their parent was a nurse practitioner who's
Okay.
thought, oh my God, if you guys had this for the medical side, that would be
Mm,
awesome. So that was kind of where the VA started. Obviously, then you got to pivot to find different types of VAs who are medically trained. So he
yeah.
goes over the Philippines 3 or 4 times. So it took him like several years to figure out and build a base and build our VA set. But once he did that, and once he saw how much help that he could provide to practices, doctors' offices, everything, that's when we made the transition. And we see he still has it. He still has a VA company for the real estate side, but we can see the med side really taking off.
Man, that's awesome. So like if someone hires you guys today, right? Like
Yeah.
how long, like what's the onboarding process and what's the time frame to get that medical VA integrated and working?
Yeah, so we, like I said, we take 3 to 4 weeks just to set that VA up. So we'll train them on your EMR, EHR, and then we'll also obviously go over typical everyday use cases for hospital practices. Make sure they're buttoned up on all of that, and then we'll give them over. And we handle all of that on us. So like you're not paying that VA to be trained or anything like that. That process usually takes, like I said, 3 to 4 weeks.
Man, that's awesome. That's a quick turnaround. That's a
Yeah.
very quick turnaround. And then like I guess the last question I would ask is from an AI and automation standpoint, how
Mhm.
do you see, VA medical staffing evolving over the next 3 to 5 years?
Um, if I'm going to be honest, it all depends on like how they can do with the conversations. Right now, like AI is great, and I think everybody can use AI. I think HIPAA is going to be a big question mark with AI,
Yeah.
and then I think those conversations back and forth with patients. So I do think AI is great, but I do think someone needs to run it, and I always think someone's going to need to run it, especially when we're
Yeah.
talking about patient care. So I think it will be. I definitely think it's going to be integrated in a lot of different practices and a lot of different healthcare companies and a lot of different systems. But at the end of the day, I do still think people need to run it. I think it's great, but I think we need to be careful. What do you
Yeah.
think
No,
about it? Just
I,
from your
I
experience?
agree. I agree. Like, yeah. I mean, AI is awesome when it comes to giving you, ideas and giving you context to like really your whatever your question is, right? To AI, it gives you ideas to use. and it
Yeah.
gives you a framework. But
Yeah.
that's you got to still add the human, nature to whatever you're trying to accomplish, right? Like it's got to, yeah, it's just really an outline, and then you piece it together with the facts, the data, whatever you're trying to, create. So
Mhm.
definitely use AI is my opinion, but it's not the end all be all. Like
Yeah.
I would never encourage someone to use it and then just copy paste and submit like that. You're gonna get in trouble. Like to your
Yeah.
point, from a HIPAA compliance standpoint. So yeah, that's what I would say. But I mean, this has been awesome, Tim. I think you know, especially where we're going with AI and automation, and I think a lot of businesses too. How I think about marketing, right? Like we talk to doctors, right, and they're like, hey, we just don't have the budget, right? But we
Right.
found out they had some kind of equipment issue that cost them $20,000. So their expenses are high, right?
Yeah.
And so that's where it's like you got to like within your business, typically, as you know, from a
Yep.
business perspective, you gotta incomes leveled out or gotta be high, and then you gotta keep your expenses low. So like
Mhm.
what you guys are doing from a VA medical professional standpoint is you're going to reduce those
Yeah.
expenses.
Cut
You're still going
costs,
to
increase
integrate
revenue.
it. Yeah,
Yeah.
absolutely. You're still going to integrate them, and they can work well with the actual teams that they have in the practice.
Right.
But you're going to be able to get a lot more done. You're going to be able to accomplish more things and be more profitable. I think that at the end of the day, what you guys are doing, you're making them more profitable.
Exactly.
So I appreciate you sharing that. If anyone wants to contact you to to start tomorrow, for example, let's say a doctor's listening to this interview, how
Okay.
do they connect with you guys to start using medical VAs?
My email address is tim@revaglobalmedical.com. We also have revaglobalmedical.com, and we are on Instagram, TikTok, Facebook. So if you want to find us, we're easy to see. We're easy to find, and we're happy to help. So, like I said, I appreciate it, Lamar. This was awesome. I had such a good time. But doctors' practices need to cut costs and increase revenue. So if you need some help, Reva would love to help.
Awesome. Thank you for sharing that, Tim. And we'll include all that information in the show notes. Again, I'm Lamar with MetaRank Interactive. This is the Healthcare Digital Marketing Podcast. Tim, thank you again for your time, and we'll see you guys next time.
Thanks, Lamar.